Well, the current flu season has been especially brutal all over the country compared to recent years. News 13's Morgan Baker is live in the newsroom with a look at local impacts in Morgan. What are medical professionals in our area saying about the virus?
Trish, I spoke with Dr. Catherine Rabin, McLeod's Chief Equality and Regional Medical Officer, who says last week in South Carolina there were 9 deaths and a little over 700 hospitalizations related to the flu. Dr. Rabin says most hospitalizations and deaths have been occurring in the 65 and up population due to weakened immune systems and possible chronic medical conditions.
That's why it's really important, even though you may only have the sniffles or not feel so sick, it's very important to protect those around you, because if someone, is undergoing cancer treatment, or they have chronic medical conditions, or even just older and their immune system is just not as healthy, it can be devastating for them.
McLeod has implemented temporary visitation restrictions at all of their hospitals, allowing patients to have no more than 2 visitors at a time, who must be 12 years of age or older and either an immediate family member or primary caregiver.
Just decreasing the number of people coming in and out of the hospital could potentially and hopefully impact the decrease in the spread of the virus, to help protect both our patients and our staff.
Dr. Rabin says it is imperative that people be careful, even if they feel healthy, as they could be carrying the virus for as long as 6 days before experiencing any symptoms, therefore unknowingly spreading the virus to others. Dr. Rabin says to help stop the spread, people should get a flu shot, avoid crowded areas, wear a mask around others if experiencing symptoms, and of course, wash their hands regularly.
I think at the new year, we want to enter the new year feeling good and hopefully have a healthy 2026. And we want to spread joy, not germs.
Dr. Rabin encourages anyone experiencing symptoms to seek medical attention from their primary care doctor or an urgent care. And if they're having shortness of breath or other serious symptoms, to head to the ER. Dr. Rabin shared that certain over-the-counter medications such as Tylenol and Motrin can alleviate symptoms, but if symptoms do not improve or get worse, seek additional medical attention. Live in the newsroom, Morgan Baker, News 13.